is this technique we're going to use now is a abduction manual therapy technique. So what would we do for this technique then?
So we're going to take Patrick into abduction. I'll just bring that up here. And then I'm going to provide a medial glide on the hip joint. Yeah, so that would be your associated glide with this movement. Take him up to that point where he's coming into restriction, and then I'll just give a medial glide in through the hip joint with my left hand. Yeah, if he has a little bit more available range, you can actually bring your leg up to support his lower limb. And again, that medial glide. Making sure I'm not bringing him into too much flexion or extension as well, and keeping it in that abduction plane.
And could you move the leg into abduction as you were doing that as well? Or?
Yeah, definitely. You could definitely put the glide on and move him into abduction.
So that would be more of a kind of mobilisation with movement, and we'll probably go through some of these mobilisations with movement with the hip as well.
I think they're really nice progressions often from these initial glides. So if you're getting some good improvements with the pure glide, then I think you'd get greater improvements with the mobilisation with movement generally.
Yeah, and with a lot of these tests we were talking about before about how would you objectively measure, and often it's a case of test retest. So test your movement, see how much they've got, do these glides or your treatment technique, and then retest and see whether that has made a difference, so that you can see whether that technique is being beneficial or not. Same thing with the other hip techniques. What we'll do is we'll go through and do a little close-up of that position, just so you can see exactly where the hand hold is on the hip.